In this video, let us learn about heart blocks. Heart block basically means there is some kind of blockage in the electrical conduction pathway of the heart. The most common site of this blockage is the AV node. Now, heart block hence is also known as the nodal block to signify the AV node, or junctional block, the junction between atrium and ventricles. So this heart block, based on its severity, can be of three types: first degree, second degree, and third degree heart block. Let us one by one understand what is the heart block. Before that, let us understand the normal physiological function of AV node. So whenever an electrical impulse comes down to AV node from SA node, AV node causes a delay and then allows that impulse to get transmitted to ventricle. This delay that is caused in the AV node is known as the nodal delay. Nodal delay. This nodal delay is important because this gives a time difference between atrial depolarization and ventricular depolarization, and hence both the atria and ventricle don't depolarize at the same point of time, and hence after atrial depolarization the blood gets time to go into the ventricle before the ventricular depolarization starts. That is the normal function of AV node. This AV nodal delay can be appreciated on an ECG. This AV nodal delay on an ECG is represented by the PR interval. The ECG shows a P wave and then comes the QRS complex. So this is P, this is QRS complex. Now, P wave represents atrial depolarization, QRS complex represents ventricular depolarization, and the time duration between those two, the isoelectric part, that is the PR interval, is significant of the AV nodal delay. Now, a normal PR interval is any time less than 0.2 seconds. On the backdrop of this understanding, let us now move on. Now, we are going into understanding the first degree heart block. Right. Now, in that, what happens? The AV nodal delay increases. In first degree heart block, nothing happens, but the nodal delay increases. This can occur if you put the patient on some kind of AV nodal blocker. Right. So basically what happens, suppose this is a normal function of the heart where you have a particular AV nodal delay. On the other hand, you have the first degree heart block when there is the AV nodal delay is increased. So basically over here, this is the AV nodal delay and this is the AV delay in heart block. So increased AV delay in case of first degree heart block. So the points to be remembered is that all impulses pass down to the ventricles, but there is increased AV nodal delay. Now we all know that AV nodal delay on ECG is represented by the PR interval, and hence in case of first degree heart block, the PR interval will be increased. As you can see over here, this is the normal PR interval, and over here we have an increased PR interval. This is the idea of first degree heart block.